Hello, my name is Dr. Taylor. I'm a professor at the University of Cincinnati, and I specialize in working with individuals who are chemically dependent. I've developed a therapeutic approach which is referred to today as Declare Therapy, which is an acronym which I believe you'll be discussing in your class. I find that my approach is effective. I utilize it in the clinic that I have developed at the Declare Therapy Center, which is a mental health and drug and alcohol treatment, community-based treatment program located in downtown Cincinnati. In one of my severe cases, was a young woman, approximately 23, 24 years of age, who became addicted to crack cocaine. At the height of her addiction, she became very emaciated and at points would not be able to use her body as a means of paying for her addiction. So one evening she went to her dealer and asked for a hit of cocaine. He refused, and she essentially begged him to give her a hit because she was suffering quite severely. And she offered to provide sexual favors, and the dealer refused because of the apparent health of this particular individual. So during this time, the dealer suggested that if she would do something in particular for him, she would be able to receive a 50-cent piece of crack cocaine. And she inquired as to what it was to do. And he said, well, just wait here and let me go back here in the back and I'll bring it out for you. So this unscrupulous dealer went to the kitchen and got two slices of butternut bread, went to the toilet, defecated, and scooped it out and spread it on the bread and brought it back and said, if you eat this, I'll give you a 50-cent piece. She initially refused, and he told her to get the hell out, and she did. But she came back later and asked, well, do I have to eat the whole thing? And he said, well, you have to eat quite a bit of it, but not the whole thing. In another case, a young man who was also addicted to crack cocaine, he was in his early 30s, and he was hurting quite a bit, and this was with another dealer. And during this period, the individual wanted to receive cocaine but didn't have any money. And the dealer said, you don't have any money, I'm a businessman, get the hell out of here. I don't want to deal with you. And the guy said, please, help me out, I'm really hurting. So in this particular instance, the dealer said, hey, I have an idea. He had two Rottweilers, and he said, if you let my dog bite you, I'll give you some cocaine. And the guy, just as in the young lady's case, refused to do it. And then he said, get out of here, I'm a businessman, or words to that effect. And the guy left, but then he came back again, and he said, well, which arm do I have to let him bite? He said, well, any one that you want. So he put his arm out, and the dealer released his dogs, and they bit the guy quite severely on his right arm. He gave him the crack cocaine, gave him a rag to wrap his arm up because he was bleeding. And he left in about half an hour later. He came back and he said, can I have some more? And the dealer said, well, you have to let my dog bite you again. And he allowed the individual to release his dogs on him, and he received his cocaine. Now, these are extreme cases. You normally don't find this in everyday type of work with people who are chemically dependent. But sometimes you will find very extreme cases, and certainly these are two extreme cases that people should be aware that drugs and alcohol, particularly crack cocaine, can offer very severe circumstances and consequences for a person who is addicted.